So my work in spine surgery is twofold. The first aspect of it is to provide evidence-based care for my patients, spectrum of non-op to operative management, make sure that they get the care that they need that's most appropriate for them. That's the first aspect of my treatment of a patient. The second aspect is my continuous involvement in keeping myself up to date with the latest and greatest in spine surgery. That involves attending conferences, presenting at conferences nationally and internationally, reading literature that's the latest in terms of what makes sense for patients, what's working well for patients, basically basing my decisions for my patients on scientific facts and what has been shown to be effective for them. I think a very important aspect for patients to understand about spine care is that the treatment that's most appropriate for them is usually the one that's the least invasive and the least involved in terms of fusion, in terms of extent of the procedure, in terms of the length of the procedure. Sometimes patients are tempted in signing up for a very large procedure, but in my clinic, what I try to do is I try to basically discuss with them the options that are available and provide them with what's most appropriate for them, what's the least invasive procedure that's going to get the job done, that's going to bring them back to function. And what that means for them is shorter hospital stay, less complications, faster return to function, and hopefully less spine surgery in the future. In my clinic, I see a wide breadth of patients with spinal problems. Could be young adults that have had a traumatic experience or have been in an accident or have a disc herniation. Could be older adults with degenerative changes that are now having difficulty walking for a prolonged period of time. And so I have the expertise to deal with a wide breadth of patients, and a wide breadth of patients tend to have spine problems. So in my free time, I enjoy playing tennis, skiing. Coming from Canada, there's a lot of ski hills there, which is a lot of fun, as well as swimming. I also enjoy traveling back to Canada, visiting family, and traveling around the world.